Hello, this is Dr. Michael Hirsch of the Worcester Division of Public Health. Welcoming you to another episode of Stay Connected with the Worcester Senior Center. And I'm your host today for the lovely month of September. So we're going to talk a little bit about September historically and some things that are celebrated in September, and then of course our little public health updates. September is a very busy month. You know, it's the 9th month of the Gregorian calendar. It used to be the 7th month. That's why the SEPT, which is the Roman abbreviation of 7, is in the name. But when the calendar switched over from the Roman calendar to the Gregorian calendar, we kept September, but we put it in the 9th month position. So it's a very important month because it's the end of summer here in the Northern Hemisphere and the beginning of school. The academic year starts in September, and that has a lot of consequences, including the fact that it's the busiest month for childhood trauma. And as a pediatric trauma surgeon, I was always trying to convince people, people have this idea when the school gets out in May or June, that that's the most likely time that kids are going to get into crashes and into pedestrian injuries and other things because they're so active and they're out playing. But actually it's September because I think over the summer where drivers don't really pay attention anymore to kids because they're not in school and the school zones are quiet. They're driving a little faster. They're not really as aware of the kids as they normally should be. And the kids also aren't trained anymore to be as careful because the traffic volume is high and they're not thinking about that as they're going to school. So we see a lot of pedestrian injuries during the month of September. And that's a bad thing for parents and trauma surgeons everywhere. So the month of September has as a birthstone the sapphire, beautiful blue stone, and a beautiful blue flower to go with it, the forget-me-not. These are beautiful items to gift your loved ones with if you are so inclined. It's a month that has only 30 days, and it's a month that has a number of national causes in it. This is National Preparedness Month, which is very important for us at the Division of Public Health. We have a division within our division of emergency preparedness, and it's very busy taking care of 74 townships in central Massachusetts, besides Worcester, which is the hub. So if a disaster would happen, we would be the point person to kind of direct where injuries might go, how nursing homes or hospitals without power in the region would be able to transport patients safely from one place to another, figuring out equipment needs. And this is something that our section head, Alyssa Aridi, is really, really great at. So kudos to her for this management. We work, of course, with the emergency management section of the city government, which is located up near the airport. And they have a wonderful center there that we used a lot during the pandemic as a kind of a nerve center for our pandemic response. So Worcester's very blessed with I think, a very good emergency preparedness system. The other things that are celebrated in the month, this is National Yoga Month. For those of you who, I know at the Senior Center, they've offered yoga for seniors, a very beautiful program of keeping yourself loose and stress-free. And if you do it regularly, people swear by it. My wife is a big practitioner, and both my kids are yoga instructors, so I'm the only one that hasn't quite adopted everything about it, but I do some yoga moves in my weight training that I do. Also for the month of September, this is National Suicide Prevention Month. Suicide is a very dastardly cause of death for adults and young adults. And creeping up as the number one cause of suicide are firearms in the home. So you may know that I do a gun buyback program to try to get weapons out of the homes, and I think that this is one of the areas that we impact the most, because suicide is a very impulsive act. People talk about, oh, I've been planning suicide for a long time, or this person been talking about taking their own life for a long time. That's not how most suicides happen. 75 to 80% of them are impulsive acts. Just a dark place that somebody gets to, and if they happen to have a gun next to them or in a place they can get to very easily, using a gun to try to complete a suicide attempt is 93% effective. So 93% of the time, if you decide to do suicide and you have a gun, you're going to be able to complete that suicide. But if you try another method, and you don't have a gun handy, if you try pills, if you try gas, if you try hanging, the overall suicide effective rate in those situations is going down into the 40% range. So you double your efficiency if you have a gun in the home. So if you have a loved one that you know is depressed, that just was laid off, that is having marital problems, that is not acting on their game, make sure that their firearm, if they have one, is secured and not easily attainable. If you're not sure about that, and if you're really worried about your loved one, you can invoke the Massachusetts red flag law, which means you can call the police, tell them that you're worried about your loved one, your friend, your spouse, and they will come and take that weapon away, at least for 72 hours, until that person has a chance to have a hearing in front of a judge to show why they should get the weapon back. Many times when this happens, the person doesn't try to get the weapon back. They were actually worried about themselves being so close to the weapon. So suicide prevention starts in the home, and you can make a big difference if you have a firearm. Keep it secured and stored properly, and if you're worried about your loved one, get it out of the house. And there are ways to do it here in Massachusetts. So what else can we talk about? The first Monday of September is Labor Day, which is a holiday that kind of gets lost in the shuffle now a little bit, but it's really supposed to be a tribute to the working person in the United States. The fact that there is a Labor Day is a tribute to hundreds and hundreds of workers who sustained horrific injuries, even murder, at the hands of the early robber barons and magnates in the steel industry and the railroad industry who didn't have any respect for their workers. They underpaid them, they overworked them, they didn't give them any benefits. They kept them almost like in company villages where there was no upward mobility, no room for social interaction other than sleeping at night. And it was the union movement that started in the late 1880s that really got the rights of the worker to the forefront. And finally, after many years of struggle, including riots and Pinkerton police being called in and other law enforcement agencies cracking down on strikers, the AFL-CIO was able to secure many of the workers' rights that we take for granted. And Labor Day is supposed to be about that. So I know people use Labor Day for all different kind of things. It's maybe the last weekend of the summer, but you should reflect a little bit on the fact that we've come a long way. The laborers do get much more in the way of rights and long-term benefits and other things that we take for granted, but we shouldn't take it for granted. On the first Sunday after Labor Day is Grandparents' Day, and I'm a grandparent now. I'm really psyched about this. I never celebrated this little holiday. I don't think many people know about it. I don't think people really celebrate it, but I'm going to celebrate it because I have two wonderful granddaughters. One is 18 months and one is a year old. They are fantastic. I just had them over at our house for a week together, and it was just so lovely. And they love each other. There's something about them. They're cousins, first cousins. They know there's a special bond there, and I can envision that they will be best friends for life. You know, that's the abbreviation BFFs. So Grandparent Day, if you're a grandparent out there, congratulations. And understand how important I think we are to the families, you know. We provide a little bit of wisdom, a little bit of babysitting, a little bit of maybe chauffeuring around, helping out our kids. And it's a wonderful sight to see when you have grandchildren that are turning into wonderful little human beings right in front of your eyes. And you can love them all you want. At the end of the day, it's really your children's responsibility to get them to sleep and get them their bath time, and that's a nice thing to be able to kind of walk away from that. But for those grandparents who are out there who are the primary caregivers of their kids, I say hats off to you, because they are a lot of work. Those grandkids can run you ragged, and I can attest to that from last week. And I'm very impressed when I hear that a grandparent has taken over parental duties for whatever circumstance. It'll keep you young, but it'll keep you running. So, got to stay in shape. One of the good days that we celebrate in September, September 11th, of course, is a Saturday. I'll talk about that a little more later. Remembering our World Trade Center disaster. It's a tough day. We're so many years out, and yet still it seems fresh when you see the pictures and you see the horror that everyone experienced, whether it was in New York or Washington or Shanksville, Pennsylvania. It's a tough day. So since that time, 2004, we established September 12th as Patriots' Day. And I don't think it's widely celebrated, but it's something to even just acknowledge that we live in a great country. We're very proud of our country. It has its flaws. Is it perfect? Absolutely not. Are there problems with equity? Are there problems with poverty? Are there problems with differences of approach to all of these problems? Yes, and we're witnessing this now. You know, we're in the height of the campaign for the presidency in 2024. It's not always sweet and nice, but it's still a country that allows for that kind of discussion and that kind of debate. And yeah, I'm a patriot. I consider myself a patriot. This country saved my parents' life, and that's something else we'll talk about towards the end of this session today. On the 17th of September, that's National Constitution Day. That celebrates the release of the Constitution in 1787, which has become a revered document that all of our subsequent laws are based on. I think that there's a lot of controversy now as to how living a document it is. It couldn't have been envisioned in 1787 that we were going to have internet and artificial intelligence and motor vehicles. There's so many things that the founding fathers couldn't have envisioned. So the document has to, I think, be modified at times, and it seems like people are strictly adherent to it when it suits them, and then kind of decide not to follow along with it when it suits them too. But at least we have it as a document, along with the Bill of Rights and the constitutional amendments that followed the original 10. We are a very, very fortunate country. The last Sunday of September is Gold Star Mothers Sunday, also not widely known about. Gold Star mothers are the mothers of the fallen soldiers in wars past and conflicts present who have lost their sons or daughters now in conflict. They must be revered for really giving their ultimate sacrifice for their family to our country. Now that we have a volunteer army, it's a very select group of mothers whose children go off and defend us on all shores, and I have nothing but admiration for them, and they should be honored with a day, a quiet day, but one at least where you contemplate the notion of losing a son or a daughter in a conflict and having them gone forever. I mean, this was a very common thing in the days of World War II and Korea and even Vietnam. But now in the days of the volunteer army, it's a very select part of our population that goes off to defend us. So we need to honor them for sure. All right, so September is a month where we're going to see the kids going back to school. And when that happens, people are asking me all the time, are we going to see a big uptick in COVID then? Now, we are in the midst, as I'm taping this here towards the middle of August, we're in the midst of a surge of COVID cases. This is a group of COVID variants called the FLIRT variants, and they are rising very rapidly in the wastewater to levels that are about half, at least, sometimes even 2/3 of where they were last winter when we had our last big surge of COVID. But this particular group of variants is not packing the same punch that the previous variants did. So we're not seeing the hospital systems overwhelmed. We're not seeing huge numbers of people in the ER and the ICU and in the morgue. But the hospitals are adapting in that we've now changed the masking laws in the hospital. Both St. Vincent's Hospital and UMass are requiring their practitioners to wear masks in clinical areas, in common areas like hallways and elevators and cafeterias. So far, that request has not gone to the actual patients or the visitors. But if the numbers keep going up, I think we will see those mask modifications requested from those visitors and patients. The biggest impact that we've seen so far of the COVID surge is in the practitioners, in the nurse practitioners, physician assistants, doctors, nurse assistants. About a month and a half ago, maybe one case of COVID a week was being seen in employee health in both institutions. Now it's up to somewhere between 7 and 10 a week. So this has caused staffing problems. It has caused some shortages and longer wait times in clinical situations. So please have some understanding that we're trying our best in the hospitals to serve you, but we need your help. So how can you help us? Well, don't go to work and don't go to school if you're sick. because this particular kind of COVID that's out there now, it doesn't cause a ton of the standard kind of symptoms. It starts out with scratchy, sore throat, itchy eyes, and then you might get a mild cough. A lot of these things can be written off to allergies, and here in late August, early September, where a lot of the allergies do kick in, you might blow off one of those symptom days as being just an allergy. Don't do that. Try and get yourself tested. And if you have a test that shows COVID, the new recommendations are you put on a mask, you wear that mask for at least 24 to 48 hours. If after 24 to 48 hours you're not having any fevers off of Tylenol, you can continue to wear the mask, but you can go back to work and you don't have to isolate anymore. But in that first couple of days, you do need to stay away from people. If you're a high-risk person, that means over the age of 60, someone that has diabetes, cardiac disease, respiratory disease, obesity, or immune disease, like HIV or lupus or rheumatoid arthritis, then it's recommended that you get your primary care doctor to give you a prescription for Paxlovid. It will shorten the duration of symptoms, it will decrease the severity of symptoms, and you'll be feeling better that much quicker. Sometimes you're taking medication that makes Paxlovid impossible to give, and then you just have to tough it out with Tylenol and time. We don't know where COVID is going. It's constantly mutating. Each time it mutates, it's trying to become more transmissible, and that's what these flirt ones are like. So here, the reason that we suppose that there's a big summer surge now is because many parts of the country, including here in Worcester, have had very, very hot summers. That's driven people indoors with air conditioning, but in tight quarters indoors, that's how this likes to spread. So we're hoping that the crest kind of peaks just at the beginning of September, but that's also Labor Day, where there's a lot of congregating going on over the Labor Day weekend holiday. And then, of course, comes the activities of school, which will drive people together, and school sports, which also drives people together, watching basketball or hockey indoors. And of course, if you're in a tight stadium for football or soccer, these are all possible spreading events. So we're hoping that Flirt has had a lot of fun over the summer, and maybe it'll go away now that the fall is coming. The autumnal equinox is always around September 20th, 21st, and hopefully by then we'll see it recede. Also in the month of September, we're hoping that we will get an announcement about a new iteration of the vaccine against COVID that's designed against these particular variants. And I would definitely recommend getting them. We haven't had a lot of compliance or interest in keeping up to date with these vaccines. Only about 20% of the population has gotten the vaccine that was made available in September, and that was recommended to be boosted in April. So I think a lot of people have just said, I'm done with COVID. It's like a cold, that's it. That's probably right for the great majority of people, but the caveat is that 10%, it seems, of folks that get COVID get long COVID, symptoms that last for more than 3 months. They're very varied symptoms. Some is brain fog, some is visual disturbances, some is cough or sore throat. Some is just a feeling of shortness of breath. Some is GI upset, so you don't feel like you have your normal appetite. Things upset your stomach easily. Some is muscle weakness. Some is unsteadiness on the feet. It's all different kind of symptoms of long COVID. And nobody knows what causes long COVID. Some people have conjectured it's actually COVID that kind of went dormant in your body and then just flares up every once in a while. Some have suggested it's your body reacting to COVID, sent antibodies to a particular area of your body, and now those antibodies are the things that are causing your symptoms. So it's like an autoimmune response. And some people think it's like the herpes virus. It just keeps reactivating and then going away, reactivating and going away. So it's not completely inconsequential, not completely harmless to get COVID. So I certainly, feeling like I'm in the risk group, I'm over 65, I am a diabetic, I'm going to get whatever shot they come out with. They might come out with a combined shot between COVID and flu. But even if they don't, I'm going to get both a flu shot and the COVID shot. And Walgreens announced this year their calculations say the flu season is going to start earlier. So they're already giving out flu shots at several of the big pharmaceutical companies out there. And you should take advantage of that. What else are we talking about? Well, the other thing in that tridemic that we had last winter and the winter before, flu, COVID, and RSV. RSV is still being recommended for people over the age of 75, for everyone, and also for RSV vaccine for the folks that are in the high-risk group, like the symptoms I mentioned before. Respiratory syncytial virus is one that mostly strikes young people. I'm talking like little children. But for older folks, it's a danger. And if you've never had an RSV vaccination, you should get one if you can, going into the winter. This winter, we're going to be seeing weird weather patterns because of this weather/wind phenomenon from the West Coast called La Nina. And all of the almanacs are predicting that we're going to have a colder, snowier winter. So that can lead to more in the way of COVID, flu, and RSV infections. They generally, as much as COVID is acting up this summer, they generally like the cold weather better. And that's a time when people are driven inside. So they spread better when you're inside, packed in with a bunch of other people. So that's kind of where the COVID situation is. Now, there are other situations out there of viral illness that we need to talk about. We are seeing for the first time this past week a human patient with West Nile virus here in Worcester County. And there was one patient with Eastern equine encephalitis, triple E, identified out in Bristol County. So the very mild winter that we had and the very wet spring that we had has led to a much bigger than normal mosquito population being out there. And Worcester has been participating in a spraying program where we harvest these mosquitoes, test them for these viruses, and whatever neighborhood we see them positive, we go out and announce that we're going to be doing spraying from a truck. If a large enough area is impacted, we will spray from the sky, but always give the neighborhoods involved advance notice so they can, for the 2 hours after the spraying happens, keep their children inside, keep their dogs inside, keep their windows closed. So far, I think, considering how many positive specimens of mosquitoes that they are collecting, having only the one West Nile patient and the one triple E patient is a very encouraging sign. And this is going to unfortunately be the new normal. With global warming, these winters are going to be milder. That's going to allow the mosquito population to burgeon sometime in the spring, and we pay the consequence for that. Now, the newer problems that we're having with mosquito-borne illnesses is that travelers from the Caribbean, travelers from the American Southeast have been coming north with dengue and chikungunya virus. And these are viruses that generally were seen in the Caribbean and South America, but there are somewhere in the range of 100 cases between the two diseases here in Massachusetts, but almost all travel related. We haven't really had any native acquisition of those two diseases. There is a mosquito, though, that we believe here in Massachusetts can bite a person that's been infected with dengue and spread it. But thus far, that hasn't happened. The tiger mosquito is one that lives in wooded areas, and it doesn't follow the rules about coming out only in dawn and dusk, like the mosquito that carries West Nile and Triple E. It comes out during the daytime in forested areas. So the other parts of our 5D plan are still good. In other words, dress appropriately, long sleeves, long pants whenever possible. DEET, which is the ingredient in insect repellent that is not cancer producing and will protect you from being bitten, and draining standing water on your property, or helping someone who can't do that drain it from their property. So old fountains or bird baths or tires, rain barrels, other kind of barrels, those all should be emptied out so that the larvae of these mosquito can't breed. As far as other viral problems that we're seeing, there hasn't been that much of an increased number of tick bite issues, but the ticks are out there. You should do a good tick check on yourself if you spent the day outside. If you go out into a grassy area, you should consider wearing socks, and socks that kind of pull up over your pant legs, because the ticks love to get in there around your ankles. And you should definitely check yourself after you've come back from a walk like that. And of course, ticks love to infect your pets. So check your pets if they're scratching, even if they've just been out for a quick romp in the woods or in the fields. Check them and try to get rid of their ticks. Also, potentially put on a collar for them that will protect them from ticks as well. So these are the problems, I think, of climate change, is that these insect-borne illnesses are going to increase unless we can reverse the tide of global warming and provide for a less enchanting environment for these ticks and mosquitoes to flourish in. There was a recent World Health Organization emergency alert put out about monkeypox, which is now called Mpox. It started in Central Africa and the Congo, and has spread through Africa because they have very little accessibility to the vaccine that we have used, the smallpox vaccine here in the United States. But the worry is that whenever it spreads like that in one continent, the world can see it spread more widespread, and eventually it'll hit our shores. We have noticed here in the United States that the spread of this disease has mostly been through gay males having sex, but that community has really been excellent in policing itself and reducing the amount of contact that they're experiencing when the summer has come to the areas that they like to vacation in. And so thus far we haven't had any active cases here in the Commonwealth. But it's something we're definitely keeping our eyes on. There's always going to be threats, and I think one thing that the pandemic has generated is many of the large organizations like the CDC and the WHO, and even the smaller ones like Mass Department of Public Health, were always on the lookout for weird things that are happening with health and trying to be like an early warning system, like the folks that can predict where tornadoes are coming. And I think it's very important. It's probably one of the biggest legacies of the pandemic, that maybe this next time we won't get caught with our pants down as much as we were for this one. All things considered, now, more than 4 years out, we're recovering quite well, but there, as you know, many people who have family members, loved ones that are not sitting around the table with them at night, and others that are suffering from long COVID that I ache for. So I would never say we won a victory against the pandemic. We rolled as much as we could with the punches, and I think all things considered, we came through it fairly well, particularly here in central Massachusetts. It took a lot of work, and I'm very proud of the work that the Division of Public Health did here in Worcester. With so many partners, we were able to mount a significant response, and I think that helped. So before I say goodbye for September, I wanted to point out three very important historical events. In 1862, on September 17th, the bloodiest single-day battle in the history of the United States was fought, and that was in Antietam, or Sharpsburg, Maryland. The forces of the Army of Northern Virginia under Robert E. Lee decided to invade the North, and they were met there by a force led by Union General George McClellan. Bloody, bloody battle. It was really more or less a draw, but because Robert E. Lee withdrew from the field before McClellan did, it's always been considered a victory. And what made it even a bigger victory is that it convinced the British not to recognize the Confederacy. The Confederacy was hoping that with all of their commerce with Britain, especially providing them with cotton that was picked by slave labor, that Britain would disregard their own anti-slavery laws and recognize the Confederacy as an independent country. When they saw that loss, they backed off. And that gave Abraham Lincoln the opportunity to use this semi-victory as an excuse to write up the Emancipation Proclamation, which was released on January 1st, 1863. And it set all the slaves free in the occupied territories of the Confederacy, not in the northern border states that had slaves like Maryland and Kentucky and West Virginia. But it was a very important event in terms of recognizing the humanity of the American black man And I think it needs to be recognized as that. If you want to go a little bit later in history, a similar date, September 17th in 1944, a very, very audacious and I think ill-conceived in retrospect program led by Field Marshal Bernard Montgomery of the British Armed Forces to try to liberate the Netherlands. Now imagine September 44 was just 3 months after D-Day, so the American and Allied forces had made their way through France, liberated Paris on August 20th, and now they were sitting right on the border of Germany, about to pour over the border and hopefully crush Hitler's forces for good. But to the north of this line between France and Germany sat the Low Countries, Belgium and the Netherlands, Holland. And it was thought that if they could drive an army northwards to the port of Antwerp in Belgium, that they would destroy the supply lines for the German army, liberate the Netherlands, and maybe force Hitler to think about surrendering. So they made a lot of progress towards that end. It was a combined British and American paratroop, predominantly paratroop effort. They dropped in excess of 40,000 paratroopers behind enemy lines. What they didn't realize that from all the defeats in France, the panzer divisions, the tank divisions of the SS and the regular army of the Germans had gone to rest up in the Netherlands, and they didn't realize the force that these armies had. So it was a wipeout. It was an absolute wipeout for the American and British forces. 30,000 paratroopers captured, at least 15,000 casualties, killed or wounded. Why it's so significant to me is that the city that they almost liberated, they liberated it for 24 hours, a city called Arnhem, was less than 30 miles away from the concentration camp where my parents were. And if that somehow had been successful, if Operation Market Garden was successful, my parents would have been liberated in the year, well, a year earlier than they were. They weren't liberated until April 1945, so they had another 9 months to spend in that hellhole that they were in. So they've made movies out of that Operation Market Garden campaign. The most famous one is called A Bridge Too Far. It's a very good movie. If you get a chance to look at it on Netflix or Prime Video, wherever you get your videos, very, very well done and very historically accurate. And then, of course, the last thing historically for September that I think will ever unfortunately mark September as a kind of a sad time is 9/11. As a New Yorker, I feel the pain and the sting of the loss of those Twin Towers. It was one of my favorite places to go for brunch or dinner. The top of the Trade Center had a beautiful restaurant called Windows on the World, all gone. And with it, I think, came a certain level of confidence about how safe we are on these shores. And I think that, you know, terrorism is a reality we've all, I think, come to live with, but it's still a very sad situation when you think about all that we have to do in the airports now, to be safe, all that we have to do in our daily lives to feel safe. My dad used to work in the World Trade Center. He was actually working on the 40th floor during the first World Trade Center bombing in 1993. And he survived that and was always a huge fan of the World Trade Center. He was part of a survivors group that they had after the first bombing. And he was really devastated when this bombing happened. He lived in a high-rise in New Jersey where he could look out of his window and he could just see the smoke billowing out of that 9/11 site for months and months and months. And he was very sad about it, and I still am. And I want to pay particular tribute to UMass. We sent our disaster management assistance team number 2 down to the crash site. Fortunately, there were not any casualties that we tended to. We tended to the first responders. We tended to the construction workers and the police officers and the firefighters who were trying to dig out just the slightest bit of DNA to try to help loved ones know what the fate of their family was. And they were down there for a month, and some of them have come back with respiratory ailments and different things related to inhaling that horrible smoke that was everywhere in Lower Manhattan during that time. So I don't want to be Debbie Downer about it. I just think that these are the kind of events that we have to remember as part of our history, part of the world's history. And anytime I get a chance to attend a memorial service related to 9/11, I do so with great pleasure in the idea that I want to honor those whose lives were lost in that building, those buildings, the ones that were lost at the Pentagon, and of course Flight 93 that went down in that little field in Shanksville, Pennsylvania, that probably prevented the Capitol building from being destroyed. I hope for you September is going to be a joyous one that is going to have a nice kind of Indian summer kind of feel to it. If you have loved ones that are going back to school, whether it's college or primary elementary school, I wish them a great year academically. And I'll be seeing you back for the first full month of fall in October. And we'll talk a little bit about how special October is for New England, where our leaves turn into just a huge show of color and joy in nature. So thanks for listening. I hope you have a wonderful month, and we'll see you next time on Stay Connected. Bye-bye.